So we move on to our next presentation with Pharmacy for Juniors. So lo que sigue es la presentación para farmacia. With us, we may have our Professor Lisa McCartney, who joined us by phone earlier. We also have our coordinator for pharmacy articulation, Sheridan Robinson, with us. I don't know if you can come off camera, Sheridan, or not. I know that you're with us. I saw you earlier.
I'm here.
Yay.
Hi, everybody.
Hello, Sheridan. So glad you're here, folks. Sheridan is a highly supportive staff that if you are students in pharmacy, you will get to know Sheridan. Miss Robinson is a wonderful support. She will take you through the areas. And I see that our presentation for pharmacy is up. So without further ado, we will have Professor McCartney present again, and she is our professor in pharmacy technician.
So welcome everybody, that you got a chance to meet Ms. Sheridan Robinson. She's our program's accreditation coordinator, and you will actually get to know her in the program and myself as well, but you will do a lot of the interacting related to some of the paperwork and compliance requirements that we have with Ms. Sheridan. And let's go ahead and we can just jump in and get started here, and have you go to the next slide if you would. So I imagine all of you probably at some point have been to your local HEB or Walgreens or CVS pharmacy, and you kind of got a peek at what the technicians back there maybe do. You can see them on the phones or filling prescriptions or maybe working the cash register. But I wanted to start out by giving you an idea of some of the other areas that pharmacy technicians practice in, because really there are probably well over 100 different areas of pharmacy that you can practice in as a technician. So let's go ahead and we'll just kind of run through these pretty quickly. Next slide. Is a very slow. So you can see there, this is your traditional sort of community or retail pharmacy practice. Places like CVS and Walmart, they are going to do a lot of customer service, work with the cash register, stock shelves, handle the drive-through and things like that. And then you can go ahead to the next slide. And between some of these slides, I also have put in some shots of some of our students in our pharmacy lab. The lab that we have is a state-of-the-art facility. You'll work with real equipment and supplies just as though you were working in an actual pharmacy. So you get to see little pictures of that along the way. Go ahead to the next slide, please.
Muna ito Dani हुन्छ
So this is the institutional or hospital pharmacy practice. Hospitals have large pharmacies in them, and those technicians will prepare all the different medications that they use in the hospital pharmacy setting. They also will prepare even the medications that are given by intravenously into a patient's vein. And you can see down there in that bottom right-hand corner, those are some of our students in one of our sterile compounding labs in there. Go ahead to the next slide, please. I don't know if there's any way to speed up, maybe too late to speed up the transition between slides. So people who work in the hospital pharmacy, they work really closely with doctors and nurses. So in this setting, instead of working with a lot of patients, you work more closely with doctors, nurses, and pharmacists. Next slide. And there's some of our folks in our sterile compounding lab spelling out ACC there. It's actually, in addition to a lot of learning, it's also a place where you'll have a lot of fun. Next slide. Some of the other areas of pharmacy you'll see are in areas that we call specialty compounding, where they might make pills, ointments, creams, suppositories, medicated lotions, and things like that. You can work with in-home healthcare, going into patients' homes. You can manage pharmacies. You can even own a pharmacy if you wish to. You can teach, or you could work for somewhere like the State Board of Pharmacy, where they go in and inspect different pharmacies for compliance with the applicable laws. Next slide. There's some more of our folks in the lab. Bill Silly. Go on to the next one. And some of the other places that a lot of places don't, that technicians work in that setting, are in marketing and sales. Sales reps, you know, getting out word about new medications are really common, that technicians work in that area. You might go into research and development of new medications. Right now, research and development is a really big deal, you know, as you might know, related to the COVID-19 vaccine. So pharmacy technicians are on the forefront of developing vaccines and working in that area. They also, we manufacture all of those things, pills and injectables and other pharmaceuticals. There are technicians that travel around the country setting up new pharmacies and training people. If you enjoy working with animals, you might work in a veterinary pharmacy, or if you wanted to work with children, in a pediatric pharmacy. Next slide. And then there's a couple others that you may not as well. There are technicians who work in both with hardware and software development. Virtual reality is a really sort of hot area related to developing virtual reality games and things like that, and simulations for the training of pharmacists and pharmacy technicians. So if you have an interest in something like that, we also do pharmacy robotics, or you know, other areas that are sort of outside of your traditional pharmacy. Next slide. So I summarized here on this, one of the reasons why you might think that this would be a good program for you. And certainly the earning of dual high school and college credit is an amazing thing. We have a really high first-time pass rate on the national certification exam. At the end of most of these programs, you take a certification exam. Our first-time pass rate is right around 98%, and that compares to a 57% first-time pass rate for other programs and people that take it. So it's a very, very high first-time pass rate. When you get out of our program, you will be prepared to work in real pharmacies out there in many different areas of pharmacy practice. A lot of people are drawn to health sciences because they want to help people, and this is a great career field for that. But the nice thing about it is that you can help people and heal people and really save lives, but you don't have to get involved in that sort of daily, you know, touching blood and being around sort of blood and body fluid stuff that not a lot of people, you have to really be cut out for that kind of thing if you want to be a nurse. And in pharmacy, you don't have to do that. What's that? Somebody say something? It's a place where there are a lot of jobs available. So most of our students get job offers either while they're working or shortly afterwards. There's lots of job openings. It's considered to be one of the fastest growing fields and what they call a recession-proof industry, that even if the economy slows down or even if jobs become harder to find for most people, pharmacy still will have a lot of jobs because of the growing population and the fact that our population is aging. There's lots of different duties and work environments you can work in. Most of the places that you would work will offer excellent benefits, things like paid health care, paid time off, paid vacations, paid holidays. Some of them even have tuition reimbursement programs. If you decided you wanted to go on and become a pharmacist or go on to earn another 4-year or more advanced degree, you could get your tuition paid for in a lot of these pharmacies if you're employed there. The starting pay that you can expect to earn is going to be between $16 and $18 an hour, depending on where you start. I have had technicians start off at higher rates of pay than that. And like I said, employer incentives, things like tuition reimbursement are becoming more and more common. Next slide. Okay, is considered to be one of the highest quality programs in the United States. We are regularly ranked in the top 5. It is an accredited education that you'll get. We're the only program in the United States that has 3 national accreditations and is also college credit transferable. So if you decided that you wanted to go on to pharmacy school, we have a direct sort of stepping stone program into pharmacy school where you can get your credits, your undergrad credits done here, your core curriculum credits done here at ACC, and then you could step directly into the College of Pharmacy at UT and quickly complete their Doctor of Pharmacy degree. So that's an amazing thing. The college credits are also transferable to other colleges if you decide you want to go on to something other than pharmacy school. If you want to become a doctor or a nurse or whatever, those credits will transfer with you. Our faculty is amazing, incredibly qualified, amazingly supportive staff. We have lots of years of real-world pharmacy experience, and our faculty and staff will go out of the way to support you and get you what you need to be successful. You'll train on real-world equipment in our state-of-the-art laboratory. And we also have really strong community partnerships. You will complete an internship where you'll do a 128-hour rotation at a pharmacy where you'll actually work. It's the last class you'll take in our program, and you'll actually go into that pharmacy. They'll train you right alongside the other technicians to work in that environment, and many students get job offers at the end of that practicum. Next slide. The other thing that's really nice is that we do have that transfer program that I spoke about a moment ago. You'll get that level 1 certificate when you graduate from our program. You can then, if you choose to, you can stay with us and get your associate degree with us. And there is a direct transfer to UT College of Pharmacy stepping stone. The other thing that's really nice is you can get your college credits done here prior to transferring to another college or university. The tuition is about 75% less than other schools. There are tons of scholarships and grants available. One thing I wanted to mention, Letitia was talking about the fact that as a student, you would likely have to be responsible for paying for your own textbooks and supplies and things like that. And some of the ISDs do pick up those costs for you, and that's something that you would want to talk to Letitia or to your high school counselor about. But there are also scholarships and grants that you can get for many of those things. So please don't let cost stop you from applying. Let us, see what we can do to marshal some resources to help you become successful and not incur that cost. Okay, next slide. So because of the agreement that between the Health Science Academy, the high schools and the college, you're saving those costs related to tuition, and that's a very big savings to you. If your ISD is covers the other costs. That's going to pay for things like tuitions, books, uniforms. There's something called Castle Branch, where you do background check and drug screen. And then other things like fingerprinting, the examination and things like that. So there are some ISEs that are covering all costs, and some of them may cover some of the costs, and some of them may just not, may just need some help kind of figuring out how we can support y'all in getting those costs covered if you need it that way. Next slide. So this kind of is just a little graphic, little bit about why this is such a great path to enter. As you go from earning that dual high school to college credit, you can go, you'll be in our technician certificate program. You can go from there directly after that and start working. When you get that level 1 certificate and pass the test, you'll be ready to go out there and start working. And most of our folks do. Some of them will also stay on and complete their associate degree. Then they'll go into the workforce, or they'll go on to the College of Pharmacy or some other 4-year degree. The great thing about pharmacy tech is that everything that you learn is really applicable to any of the health sciences. So if you feel like, you know, my end goal is that I want to be a doctor, or I want to be a nurse or a veterinarian, what you learn in pharmacy is going to apply to all of those other health science professions. And that's going to be really helpful to you as you go forward. Next slide. I think I lost the slide. I don't see the slides anymore.
I've lost the slide.
I'm jumping on. I'll share my screen. Here we go. Sorry.
No worries.
I'm wearing multiple hats, so it's gonna look like this. Is that okay?
Let's get back up to that other slide a little bit further up.
Right here?
I think we are a couple more. No, right there. Yeah. So this is just one more slide down. That one. Yeah. Next slide. There we are. Okay. So brief kind of look at what in the first semester, which would be the fall of your junior year, you'd have 2 courses. Semester 2, the spring of your junior year, you'd have 2 courses. And then next slide. Same thing with your senior year. You'd have 2 in the fall and spring there as well. And really the way it works is that Monday through Thursday, from about 2:30 until 5, that's when you would be in class with us. All right, next slide. In order to come into the Health Science Academy, each program has a set of program compliance and regulatory requirements. Some of them will require you to use something called Castle Branch, which is a documents repository. So you may hear us talk about that a little bit. But I wanted to just briefly run through what those requirements are. So next slide. Again, you'll be in class Monday through approximately 2:30 until a little after 5. Mostly those classes will take place at the Health Science Academy, which is near the Eastview campus. And when those classes are being conducted live, you'll be transported by bus to and from the Eastview campus and then back to your high school, unless your school has made other arrangements for transportation. In the time of COVID right now, many of our courses are online, but they take place in a program called Blackboard, which is the learning management system, where you can interact with your instructor and your fellow students. You'll see each other, you'll be able to share with each other, you'll be able to use the whiteboard in class, so it's a very interactive environment. When you get to the point in your senior year of having lab classes, those are conducted at Eastview. If you could go back one, yeah, right here. So the other thing is attendance for all of our classes is mandatory. So just know that. Then there are a couple of things that we would like you to be aware of. You must have an ACC photo ID, and we'll talk to you when the time comes about how to get that. But you must also have a government issued photo ID or driver's license. So if you don't have one of those, it's a good idea to go ahead and start working on getting one of those, because you have to have that when you get into the program. Next slide. There are some compliance requirements, things like immunizations, TB skin tests, flu shot, things like that. And we will, of course, guide you in, getting you the forms and giving you everything you need. But those will be requirements where you'll have to go either to your physician or, you can, a lot of these you can get done at Walmart or Walgreens and things like that. To get those done. So those are just some of the compliance requirements. Sorry, next slide. Another compliance requirement is the health data form, which requires you to get a very basic physical. A lot of times you can get the immunizations, the skin test, and the physical done all at once. And we will provide you with the forms and tell you what to do with all that. Next slide. You are required health insurance coverage by the fall of your senior year. So if you don't already have that, we will provide you with some information about potential resources that you could use to get that. Next slide. There will, toward the end, there will be a drug screen required. That drug screen will test for all recreational or non-prescribed drugs. There we are. So just know that it will also test for alcohol. If you are on a prescribed medication that you know is a controlled substance, whether it's an anti-anxiety medication or something that you take for ADHD or something, please continue taking your medication as prescribed. We don't want you to stop taking anything that's been prescribed to you. If when it's time to do the drug screen, that medication is found on the drug screen, what will happen is the ACC Health Science Compliance Coordinator will contact you. Actually, I think it's the drug screening location now, will contact you just to ask to see a copy of your prescription. So as long as you can show them the prescription bottle or a copy of your prescription or a letter from your doctor, you're fine. So please take all your medications as prescribed. But that would come up, the drug screen would happen in your senior year. Next slide. There are a couple of criminal checks that get run during your time in the program. If you have any criminal history, if you've ever been arrested, just when you're answering when you're doing the criminal background check, it'll ask you some questions. Answer all those questions honestly. If you were arrested for any reason, even if it was a mistake in identity, if you were arrested, answer that question honestly. Even if it's been expunged, adjudicated, you don't think it's on your record anymore, the type of background check that they run will absolutely pull up every single thing that's ever happened in your criminal history. And what will happen is that you'll just be required to show some paperwork to prove that it was indeed expunged or adjudicated or you completed the requirements. So it's generally not a big deal. Most of those criminal background check things will get approved, provided that you answer all of your questions honestly. If you have any specific questions about that, because there are certain things that would prevent you from being able to come into this program, and those would be related to any felony convictions, anything that had to do with violence or anything like that. those types of things, we can have that discussion privately, and Letitia can help to set that up just so we can get your specific questions answered. Next slide. You will be required to register with the Texas State Board of Pharmacy as a pharmacy technician trainee. And that does require that you have a Social Security number. That's not something that we can get around. It's a state of Texas requirement. It's their law, not ours. It's not ACC's. So you must have that Social Security number as a requirement for coming into our program because of that rule. And then at the very end of the program, of the pharmacy tech program, you'll take the national certification exam. And that's what will allow you to then upgrade your status with the State Board of Pharmacy to become a registered pharmacy technician. Next slide. There are tons of resources to support you. So in addition to all of our faculty and staff, and also the career and programs faculty, their staff there are a ton of people at ACC who are ready to support you. We also have support related to things like counseling services, student accessibility services. We have a food bank, tutoring support, computer labs, and all kinds of fun stuff available to support you. Pardon me, I'm giggling a little bit. Next slide.